Does Washington State's Department of Health want to put you and I in COVID camps? Let's find out. Thank you for watching. My name is Glen Morgan, and this is We the Govern. And as always, I'm going to start this video like I have before, referencing the fact that nothing I say here has been approved by Inslee's Ministry of COVID Compliance. And since COVID is going to be part of the topic that we're going to be talking about today, that's most important that I bring that up now, because if you only want to listen to what Inslee's Ministry of COVID Compliance wants you to hear, you will not like what I have to say, and you should stop watching now. For everyone else, let's talk about where we're at. And of course, it is Omicron. The Omicron variant is scaring everybody, and it's a terribly destructive concern, and we're in the middle of this fear porn cycle that I've documented before, where basically every time it feels like we're coming out of this thing, we're going to have a new variant, new cases, more restrictions, booster it up, and then slightly ease those restrictions. And that's just the nature of where we're at right now. It's going on all around the country, but particularly in states that are run by governors as incompetent as our governor, Governor Inslee here in Washington State. Most recently, Washington State's Department of Health has come under attention and fire from a lot of activists from all around the state because of a hearing that they were proposing for some rule changes or rule considerations that they were putting out. Now, I want to make a point, because the big question that came out of this was, are they trying to put us into COVID concentration camps of some kind? Because, of course, the rules that they were reviewing involved involuntary, basically putting people involuntarily into some kind of a quarantine. And it's pretty scary language. We've talked about it before. And there's no reason why you wouldn't be concerned right now if you're looking at Washington State, because look at the clowns who run the state right now. It doesn't matter when they were talking about Seattle, our Attorney General, or the people that are in charge of public education who don't really care about literacy rates collapsing, but they're certainly prioritizing CRT, critical race theory, and sex ed in the school. We got to have that priority. So regardless of whatever clown is in office right now, many people are concerned because we're seeing really poor, bad behavior, terrible choices, and crazy people running the state. So there's no surprise that there would be a lot of concern about what's actually going on right now. And that's also shouldn't be surprised, because after all, we had a virus, and now suddenly all these people want to destroy the state constitution and the federal constitution. They want to burn up the Bill of Rights, and they want to destroy them for any excuse they can find. And that's why you see billboards like this down in Lewis County. And of course, that's also why you have had a lot of people very concerned when they see things like this, where the governor decides to bring out the National Guard, as he did a year ago, and block the state capitol for the first time in state history, preventing people, any citizen at all, from having any access to their legislators or the ability to testify during the legislative session. I mean, this is really unprecedented. It's never happened before. And so because of crazy stuff like this that our governor has totally has done for no reason, and the Democrats cheered it because this allowed them to have one of the craziest legislative sessions ever, where they were able to kick out billions of extra dollars to their friends and insiders and cut the public off from access to the legislative session, prevent legislators from being able to speak by hitting the mute button. Just a lot of crazy stuff that has gone on over the last year. So nobody should be surprised when we see Governor Inslee like this, acting like a king, doing everything that he can to be entirely out of control. Then there's no reason to be surprised when people are concerned when they read about WACs like this. Now, a WAC means it's a Washington Administrative Code, and specifically the one I'm looking at is 246-100-40. And this is the code that references procedures for isolation or quarantine. And I reference this one very specifically because I've talked about it in previous videos. About 6 months ago, I did a video just about a COVID camp quarantine facility that was set up down in Lewis County. And it came out of a story related to basically job postings that you saw the health departments putting out in regards to strike team. They wanted to hire these strike team consultants to go out and talk to people to see if they needed to go to these COVID quarantine camps. And of course, it got national news. There was a lot of attention put on it. Specifically, this facility, which I drive by on a weekly basis all the time, San Luis County, and this is a little hotel, and I stopped by there. In fact, this morning, before this video was being filmed, I went and stopped by there as well, and the place looks pretty much empty right now. But it's because of places like this, and there's a number of them around the state, that people were getting concerned. Now, I do think there's been some exaggeration about what these are and what's going on, but I don't blame people for being concerned, because we've had nuts and craziness all around the state for quite a while, and when you have rules like that are very scary, that say that the state can say and the health officers can make you go to some kind of a quarantine facility against your will, that's concerning, and it should be concerning. And I mentioned in my previous video on that subject that rule needs to be eliminated. Keep in mind, that was not a law passed by the state legislature. That's a rule created by a state agency, and that rule's from 2003. It's an old one, I believe, just looking at the time frame on that it came out around the SARS epidemic. But regardless of why, the justification as to why it exists, now that we're seeing just how out of control these guys have been, there's really good reason to go back and look very carefully at all these rules and see what's going on. Now, this right here is a quarantine notice from 1937, and it's from Cowlitz County Wahkiakum Health District. I've got a copy of this online. I can't remember where I had this. I've used this before in a few videos, but the Washington State Health Department wants you to think that nothing new is going on, that they've always done stuff like this, but that's really not true. They've had quarantines, like in this case of a polio family or somebody, where they want them to stay in there and not infect everybody else. But what we're really doing is we're talking about this mass quarantine camp against your will kind of approach that the previous WAC and some of these others seem to imply that these guys would be willing to do. And listen, after all, since Inslee locked us out of the state legislature for an entire year, then why would he not do something equally as crazy? Now listen, I think America has a wonderful history, and that there were many brilliant people that founded America. And we've talked about this before, and of course it's a common theme among those who care about freedom and liberty, just kind of the genius of the American founding. Now obviously I'm not a big fan of CRT, critical race theory, which says that everything about America is hateful, terrible, and horrible. However, the one thing that we can also kind of agree on is that at this point in time, when you look at government as particularly the bureaucrat level, but also at the political level, it's oftentimes run by idiots. And so this is the problem that we have, is as great as the country might be, the people who run the government are really not so great. And that's the problem that we end up running into. Hence the concern when we talk about the Department of Health and these crazy rules that they're recommending to be changed. And one of the reasons why the recommendations are a concern is that Governor Inslee and OSPI Chris Reichdahl, both of them have oftentimes proposed formal mandates based on recommendations. Even though the rules aren't necessarily a law, they're just simply a recommendation, they're basically treated like a law, and that's how they apply it. So people have good reason to be concerned about it. Now, when we're talking about the Department of Health, this reminds me of an old joke that they have. What do you call somebody who's the worst student in medical school, who graduates from medical school, bottom of the class, last guy out, barely able to make it? You call them doctor, just like anybody else. So where do people like that go to practice medicine? Well, if they don't go to a hospital and start killing people quickly, they'll oftentimes gravitate and go to a place like Department of Health and go work there. That's just not unusual. And also, when you look at Washington State more specifically, you have Evergreen State College nearby, where you get a lot of people like this who are graduating from Evergreen State College, unable to get a job in the private sector for some reason. And a lot of businesses refuse to hire anybody with an Evergreen State College degree. In fact, it's very, very common. Same reason why a lot of parents won't let their kids go to Evergreen State College under any circumstances, because they know just how toxic and terrible that institution has become, which is why it has collapsed over 50% in student enrollment over the last few years. But nevertheless, there still are people who, by mistake or on purpose, decided to go there and suffer through whatever it took to get out of that institution, and now they're mostly unemployable. So where do they go? Well, this Washington State bureaucracy is going to take all these people. If they can't be employed anywhere else, they're going to hire a lot of Evergreen State College graduates, and they're going to end up in places like the Department of Health. So you're not going to necessarily have the highest quality workforce there, regardless of whatever titles and claims that they might say. So the question is, do they want to put you in COVID camps, right? That's the question that we started out with here. And of course, related to that is, would these guys lie to us? Would the Department of Health lie to us? And I want to point out that one of the things that when we talk about bureaucracy is that, corrupt bureaucracy And I believe that most of it, the bigger it gets, the more corrupt it tends to be. Any place you have 2 or more bureaucrats gathered, there will be some level of corruption and incompetence that goes on. So are they always out there stealing money? Not necessarily, but they're going to be out there wasting it, and they're going to be out there asking for ways of paying back their supporters or the insiders or those who can influence them. There's all kinds of ways it happens, and it doesn't require a bribe. There's also the natural attitude that bureaucrats tend to have, especially in these departments, about how they don't really work for the people. They are going to work to suppress the people, the peasants and the serfs, the rest of us. We're just simply interlopers in their bureaucratic empire building exercise, and therefore they're going to be imposing their rules on us at any opportunity that they have. Because it is the nature of bureaucracy to perpetuate itself. This is a fundamental misunderstanding sometimes I think that people have about bureaucracy. It doesn't exist to help us. They aren't servants of the people. That is not their mentality. Anytime you look through emails or actions or decisions and you're wondering why the heck are they doing such crazy, stupid things, it's because they're there to perpetuate themselves. And anything that can increase their budget, anything that can increase their power, increase the number of rules and laws, no matter how ridiculous or extreme, that they can have the ability to kind of manipulate and be involved in your life, they're going to push for it. It's very natural, sort of a nature of man kind of thing too, because that's how you get more money. That's how you increase your budget. You got to expand the scope of your bureaucracy, the empire of bureaucracy that you have. And so they're always going to do this. It's just going to be how things operate. And so restraining the growth of that government, I think, is a big, big priority for people who care about what's going on. Now, for my experience with the Department of Health, it is not proven to be good when it comes to their honesty or willingness to be truthful. And in 2016, I had a lot of interaction with the Department of Health in regards to septic systems. And this had more to do with the property rights issue. And the Department of Health coming up, because they also are involved in septic systems around the state. And so the Department of Health was basically falsifying data and falsifying studies in an attempt to exaggerate or lie about the danger that septic systems had in the environment. And this was flat out, I mean, they were willing to commit total fraud. The employees were. And so one of the things they would do, in this case, we went up to the King County Health Department and we looked through all their reports for failing septic systems and found that the vast majority of them they actually falsified the data so they could present it to the King County Department to justify a tax, to justify an increase in the abusiveness and scope and power of Department of Health officials. And we raised a lot of attention to this. It also had to do with the Thurston County Health Department falsifying their study that they did about failing septic systems. Clearly false. It's a fraudulent study from the beginning. And faking that data and then basically populating that data into all the reports the Department of Health and the Department of Ecology had. In fact, they still use that fake data now today, even though it's been disproven time and time again to be fraudulent. And so in this case, we were able to get King County to back down after 1,500 people showed up at a number of public hearings. This is just one of them. And I wrote several articles about this in 2016. So I had a lot of interaction with the health department at the time, both the state and the local level. And at the state level, we went to a lot of their meetings and, had a lot of records requests, digging through a lot of their rules. And we really got a chance to see a little bit behind the curtain and how the sausage is made. And it's an ugly thing to look at and not a pretty sight when you look at how these guys actually operate. So there's really nothing new to see here as far as how this agency operates. But this is the first time it's really affected so many people under the whole COVID rules that are coming out now. So the first question is, will they lie to you? And the answer to that is, of course they're going to lie to you. They're going to lie to you all the time if they think they can get away with it. They're not going to tend to want to lie when they're going to get caught. They don't like getting caught. And but they're going to lie to you almost every chance they get if it helps them bloat their budget. It's an automatic answer. There's a narrative and a budget that they're pushing for. They will lie to you every time. So related to that, will they fake the science? Will they create false data? Will they lie about it? And the answer to that, of course they will. They will do that every single chance they get, again, if they think they can get away with it, and particularly if it helps them bloat their budget. It always comes back to that. So then, to get to our original question with the video is, are they wanting to put people in concentration camps? Are they planning to do these COVID concentration camps that we've been concerned about? And I think the answer to that right now is no. But there's a qualification here, and that is that not yet, but they might if they think they can get away with it, if we let them. if we don't push back on them, because there's really nothing to constrain them. It's not like Governor Inslee is interested in controlling this at all. I think both Governor Inslee and AG Ferguson would love to create COVID concentration camps so they could put their political enemies in there, and so would the Democratic Party. That's how they're rolling right now. Those are the things they say. The bureaucracy would be happy to go along with it as long as they come up with some kind of an edifice of a narrative to justify what they're doing. But they won't if they get a lot of blowback, a lot of pushback, a lot of exposure. And I think lately they've been getting a lot of exposure with people looking now, for the first time probably in state history, looking very closely now at a lot of these ridiculous rules, these WACs, these Washington Administrative Codes, that this bureaucracy is making, whether they call it a recommendation or whether it's an actual rule. But the process is corrupted, and the people behind it tend to be corrupt, and there's nothing really good about it. It's an ugly thing. And this should really come as no surprise to anybody who's paid attention to government, because the bigger the bureaucracy gets, the bigger the government gets, the smaller and the more reduced our freedoms and liberties become. This is the natural progression. These things tend to operate that way. If it gets big and bloated, we get smaller and abused, because that is how they have to exist. And this is why those of us who care about freedom and liberty push back against big government. Because after all, would anybody trust these clowns? I mean, would you really trust these guys? Yeah, technically they're in charge. They run the bureaucracy. These guys aren't going to hold the bureaucracy back. They're going to, if anything, find ways to be cheerleaders and push it on and make it worse. And so because of that, the people, those you and I, and people who are willing to expose the truth about what's going on here, that's the only constraint that they have. With a limited constraint legally, depending on the attitude of the judge you get in front of. But basically, it's just you and I. So Inslee's using Omicron and the fear of Omicron and the endless fear porn around COVID, of course, to basically demonstrate his behavior and the fact that he is moronic in many of the other policies that he's pushing. And now for the first time, because they're so big and so obvious and so impactful, people are actually realizing what kind of governor we have, what kind of administration this really is, and how the bureaucracy is entirely out of control. And yet it is exactly what happens every time big government gets in charge. It doesn't matter whether it's Department of Health today or DSHS tomorrow or Labor and Industries or Department of Ecology. Whatever department you want to look at, you're going to find similar trends going on there. But of course, I think any time that we find and discover something like this, we need to be involved and engaged in pushing back. Now, if you want to learn more, go to wethegovern.com. You can also, I have a lot of source links to some of this information down below, and some of the history articles that I referenced here as well. And I just want to encourage you to subscribe to our free email newsletters there. If you want to support us, you can also go down and financially support We the Govern. And please don't forget to subscribe to this channel, share it with others. And remember, if you want to push back, just like we did in King County several years ago, just like we have to do right now at the Department of Health, we have to show up, because the future belongs to those who show up.